It's a reasonably common thing in my practice to have referrals where people have had surgery on another area and actually the problem's been the hip, or they've got pain in another area and they think it's from there but it's actually coming from the hip. So we need to get our heads around the fact that pain is not always where it seems to be. You can have something called referred pain, and typically with hip pain, sometimes you might feel that the pain is in the knee. So it's very important to realise that sometimes you might feel the pain's in the front of the knee. It's strange, but it certainly happens. The other thing that I've seen relatively frequently is people who've had back pain and have had surgery on the back when in fact it's been coming from the hip. We have all this imaging available, and if you take an MRI scan or a CT scan of your lower back and you're over the age of 40, you will see pathology in your lower back. Everybody has it. Often it's completely normal. So you have to be able to work out what's normal and what's abnormal and what's clinically relevant. Just be a little bit cautious. Lower back pain, pain radiating down the leg to the level of the knee, not below the knee typically, but to the level of the knee certainly. Pain that's felt in the groin typically is from the hip. The incidence of asymptomatic hernia is 15%. So 15% of people have a hernia that's completely asymptomatic and that doesn't need treatment. That's inguinal hernias we're talking about. So it's perfectly possible that your GP might send you for an ultrasound of the groin and you pick up a hernia and actually it's not causing your problems. It's the hip that's causing it. So just something to bear in mind for patients and for GPs that pain is not always where it seems to be.